Okay, so I'm going to be injecting, like I said, the Silk, which is a injectable hyaluronic acid, which there are multiple different types of subdermal fillers which are hyaluronic acid, such as Juvederm and Restylane. Those are all hyaluronic acids also. This is a similar product. Silk is a hyaluronic acid. So I'm going to start on her lower eyelid area. First I'm going to prep a bit with some alcohol swabs so that she's got a clean surface for me to inject. And as I said in the beginning, as I inject, she will have a little bit of discomfort because we have not put anything but topical numbing cream, but as the gel filler goes in, it will continue to provide her with some topical and local anesthetic. Okay, go ahead and look toward with just your eyes, Erica, look up toward your, good. Okay, so small little prick. Feel a little poke, a little burning and stinging. And this you want to put deep enough in the tissues that it's not going to leave any lumps or bumps. Okay, turn a little bit this way. And we sometimes put some little ice compresses so that the patient is comfortable during the procedure. Okay, look up toward the top of your head this way, all the way, good. Your gaze, little poke. Maybe a little bit. And as you can see, Erica's very comfortable. I'm not causing too much discomfort on her.
I barely feel it.
Which I think is another reason why the Silk is so nice, because it really has minimal, you use a very small needle, and as you're injecting, you do have that topical lidocaine effect. Okay. She'd like a little fuller lips. Erica already has absolutely gorgeous lips. And I keep telling her I don't think she needs any more on her lips, but she likes a full lip, and many people do. And we're going to put a little cold pack on her lips. And that just helps, block a little bit more of the pain sensation. Okay, and when I do the lips, I like to grab the lip and squeeze it a bit, because I think it tends to take a little bit more of the pain away, so you're not too uncomfortable. And then just slowly inject the filler. And I like to go right along what we call the vermilion border, which is right along the border of the lip proper, and that tends to give a nice fullness. And then into the lip proper. Now typically in the normal anatomic lip, the lower lip is going to be a bit fuller than the upper lip, so you want to try to keep those proportions. Now a bit into the upper lip, along the vermilion border. And again, like I said, she seems to be very comfortable. I think it helps doing the topical. When we put the topical cream on, we will put it all over the outside of the lip as well as on the inside of the mucosa of the lip, and it tends to give you a pretty near complete block. But the lips are the most sensitive area on the body, so we try to get you as comfortable as possible so that when you're having your injection, you don't have a bad experience. I like to do a little bit of fullness into the tubercle of the upper lip because I think it tends to give you a nice pout. And to accentuate the Cupid's bow at the top, and that tends to give a very beautiful full lip. Now right now she's a bit swollen, but she looks like she might be corrected a little more on the upper than the lower. So I'm going to put a bit more into the lower lip to keep those proportions as I discussed, where you've got a bit more fullness on the lower than you do the upper. And that's it. And that was 1 cc. And if you can get a close-up so we can show everybody how beautiful her lips look, with minimal swelling, no bruising, beautiful lips.